My name is Megan Zimmer, and I am going to be talking about chapters 6 and 7 from our textbooks this week. This week, I felt like we learned a lot of really valuable information. Chapter 6 talked about economics and finance and healthcare. So essentially, some of the main things that they talked about included the importance of cash flows, expenses, balance sheets, reporting tools, accounting, and the immense need for our medical managers to be able to understand, at least a little bit of a background in accounting and finance. It also talked about budgeting, different types of business plans, things like that. And one of the things I did want to bring up was something that I found really interesting on page 111. It said, increasing pressure is being applied by the payer community to document the return on investment, the ROI, of quality improvement activities. So chapter 6 talked a lot about like the money side, payers, business plans, different types of models, finance reporting, things like that. And it really just tied into what we talk about in chapter 7, which is all about utilization management. So a couple of the key elements and things that were talked about were for the business case for quality management. It talked about government mandates, demands on the business by the community and kind of what's needed from them. It requires a lot of quality oversight, which is obviously a huge part of the reason why we do all of this. Is we're all looking for the how it implements different quality improvement changes. It talked about the demand for different business partners and all the different financial effects that has. That's talked a lot about, I believe, on page, I think it was 129. One thing that I found really interesting was on page 125, and it talks about just some general business principles that are really important. The first is organizational planning and the planning process. Number 2 is project management. 3, creation of business plans. 4, preparation of pro formula finance statements. 5, performance of sensitivity analysis, and 6, understanding of an organizational psychology. Again, these are things that are just really important to be sure that you're having a stable and healthy healthcare organization. Another thing that I found really interesting, just kind of talking about the basic concepts of business and economics, are they do really affect quality, because a lot of quality, one of the things we learned about this week is quality and cost do often coincide. So if we are, putting our money just into expenses, things like that, and we don't properly budget for different quality improvement plans, we're gonna have some pretty severe problems. One of the things that I definitely wanted to bring up were for utility management, just the talks about the 9 tasks, which I found really interesting. And that is found, give me one moment, that is found on page, I do apologize. Okay. You know what, that's all right. I have it written down here. But this talks about determining priority areas, identifying the needs. A lot of this is just kind of finding like the data. It talks about establishing appropriate benchmarks. It also talks about design, data collection, and data management, which is huge. That's kind of why I'm doing my quality report. My quality plan on data analysis, specifically, working with electronic medical record systems, things like that, and how that can improve quality. Number 5 talks about implementing data collection and management procedures. And number 6, evaluating the data and presenting results. 7, develop guidelines, policies, and procedures. This is huge. If we don't have any sort of baseline, if we don't have any guidelines in place, how can we effectively, work on this utilization management? 8 is implementing guidelines, policies, and procedures. Again, kind of training your staff on the importance of utilization management and then what it means to them in their current role in healthcare. And then number 9 is continuously review the task list. And this really plays into kind of my role as a healthcare professional, and also one of the things I think is most important, which is continuity of care. The last 2 chapters really talk about things like disease management, case management, care plans, demand management, peer reviews, credentialing, things like that, that all really directly affect patient care. I think that one of the things we really need to focus on is really focusing on the patient. I work for a healthcare organization that focuses on patient-centered medical home, which is really cool because we did talk about that this week. It is found in chapter 7. And what this really means, I think it was on page 164, kind of talks about what a patient-centered medical home really means. They talk about how your PCP is really there to help manage your care. There's that personal touch, there's care coordination, which is oftentimes done by registered nurses. There's quality and safety management, which is included for that patient-centered medical home. It also enhances access, and then it works on things like payment, which ties into chapter 6, where we talk about payments. And just the financial, economic, different roles that also affect quality. And I think that the biggest thing is continuity of care is so important. I think it's one of the biggest areas that really affects directly, our patient outcomes, and also patient satisfaction. So when thinking about quality, what I really learned this week is that we do have a huge responsibility to our patients to work on utilization management, to also be sure that we are working on continuity of care because it is greatly important. So again, learned a lot this week. Very excited to continue as we're going into week 5. And again, I just want to reiterate that money is obviously important, but at the end of the day, we really just need to focus on our patients. So thank you so much. It was a great week. Bye.